live on Facebook. Assalamu alaikum, everyone. Thank you for joining this webinar by the IMANA Education Committee. In recognition of National Dental Hygiene Month, the IMANA Education Committee is hosting a webinar with Dr. Juweria Amjed to spread awareness about how you can achieve optimal oral health. Without proper dental hygiene, you put yourself at risk of developing issues such as tooth decay and gum disease. Tune in to learn how taking care of our mouth, teeth, and gums positively impacts other aspects of your life. You'll have the opportunity to ask and get answers to questions during the live webinar. Dr. Juweria Amjed is a foreign-trained dentist from India. She completed her BDS from NTR University in India. She moved to the US in 2014 and graduated from UIC College of Dentistry as DMD. She practices in Villa Park in Chicago. Dr. Amjed has volunteered for various community events along with UIC in educating parents and children about the importance of good oral hygiene practices. Thank you, Dr. Amjed, for your time and for doing this very important webinar. We truly appreciate it and looking forward to this webinar. Thank you.
Thank you, Juweria. Assalamu alaikum, everyone. My name is Dr. Amjed. I'm a general dentist practicing in the Chicagoland area, and as Juweria also introduced and spoke a few things. Thank you so much, Juweria. I've been practicing dentistry since I graduated in India. I also had, once I came to the US, I also had the opportunity to do a couple of oral hygiene camps along with UIC. Most important questions that I actually got during these camps was, or these community events was, oh, how do I brush? Okay, how do I floss? How often do we floss? What age should we take our kid for the first visit? So for today's webinar, we're going to be going over a lot of things, but most importantly, we're going to focus on certain things. The first one is brushing. Okay. A lot of people are like, okay, why is brushing important, right? Most common reason you can think about is like, okay, I want my teeth to look good. I want to look good. Okay, so there's just a little prop that we had from UIC. So if you guys can see what happens when you don't brush your teeth. First, see the redness of the gums starts as an inflammation, most commonly called, people say that, oh, gingivitis, bleeding. Second, you see the color change, tartar deposits, okay? You start cavities between your teeth, okay? Various areas. It goes on, you end up with, blisters, you end up with a lot of abscesses and all of that stuff. It's something that doesn't happen within a day or two. It's something that gradually builds up to this, okay? Now, there are many methods of brushing. Right. In olden days, a lot of people didn't have access to toothbrushes, so they would often use miswak, the one of the most oldest methods of brushing. The other one that was most commonly used was neem sticks. Now, miswak is a traditional chewing stick that is prepared from the roots, twigs, and stems of a plant called salvatora. It's been a natural method of cleaning for over 1,000 years at this point now. Even to this date, in some rural areas, people still use neem sticks as a method of brushing. We are lucky, alhamdulillah, that we have access to a lot of things where people still don't have them. When we talk about toothbrushes now, we recommend patients use a soft bristle brush. Okay, a toothpaste with less abrasives. Okay, most common thing I notice is like people, they believe that, the harder you brush, the better you brush. No, that's a myth. Brushing generally doesn't work like that. Okay, hard brushing is not efficient brushing. Okay, so no matter how long you brush, if you brush it incorrectly, you're actually damaging more than you're actually helping yourself. Okay. Now, when we talk about, how do we brush, all right? So I'm going to show you a small video on how to brush, okay? Let's see if you can go ahead and then I'll play the video of how to brush.
To keep your mouth healthy, It's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months. Sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
Commonly that we see is like we tell patients, okay, you know what, start by placing your toothbrush at a 45-degree angle, okay? And then you go gently, and I'm assuming we're having some issues with the video. So what I'm going to do is I'm also going to show you on how to do it. So this is a model again, okay? We see these, okay? Brush, top, bottom. Important thing, you are going to angulate at a 45-degree angle, okay? Never brush this way. A lot of patients are like, oh, we literally scrape. No, you're not sandpapering your teeth, okay? So you're going to angle it at a 45-degree angle, okay? You're going to go back and forth, okay? 20 to 30 strokes at a time, okay? Or you can go in short circular strokes at the same time. You go all around, all right? The same way, 45-degree angle, even when you're brushing the bottom ones, okay? Same thing. Now, one thing I always tell patients, okay, most commonly ignored, you're supposed to brush the insides of the teeth as well, okay? You're gonna, same thing, you're gonna keep the 45-degree angle, you're gonna come forward. Now, when you come on the front, you're gonna brush it this way, okay? Same thing, go all around, even for the bottom. When you go to clean the inner surface of the front teeth, you're gonna tilt the brush vertically and make several up and down strokes, okay? Often missed spots are the inside. So that's the reason that's one areas that we will often see, like, okay, you go for your cleaning in 6 months, you're like, okay, these areas, we see most of the tartar buildup. So we always recommend patients use a soft bristle brush, follow your 45-degree angle, go in short circular strokes. Please do not brush horizontally. Too much pressure is never good. That's the reason if you even notice in a lot of these electric toothbrushes that come out, the moment you start putting too much pressure, it starts throwing a beep. That indicates that, okay, you know what, you're putting a little too much pressure, right? Now, if you're using a regular toothbrush, manual toothbrush, we always tell patients, okay, replace your toothbrush every 3 or 4 months or sooner if you notice that your bristles are getting frayed or they're diverging outwards. For your toothpaste, always recommended. Always look for an ADA. The moment you notice it, okay, you can go ahead and do that, okay? Now that is for your toothbrushing. Next comes flossing, okay? Flossing your teeth every single day helps clean the areas that the toothbrush cannot reach, okay? What that means is like you have your contacts, they come close up your teeth. Your brush cannot go between two teeth. So what you do, you have to use a floss. You have to use a floss. This prevents buildup of plaque, clear sticky coatings that form between your teeth. As tartar builds up and you're not able to clean these areas, it causes swelling of your gums, okay? Which is the first stage of gum disease, which, like I told you, is called as gingivitis. When it starts to go deposit continuously, it starts to go below your gum line. That's when the more problematic situation starts, what we call as a periodontal disease, or often called as perio. And conditions like these, we recommend patients, okay, you know what, get your deep cleanings done, okay? Now, once you start your deep cleaning, a lot of patients are either not informed or misinformed. Once you start your deep cleaning, every 4 months to 3 months, depending on the severity of your case, you have to go for something what we call as a periodontal maintenance. That is, we're maintaining everything that we've cleaned. We're making sure that these buildups don't start, forming again to a level where, it becomes impossible for you to start cleaning them and going back to a dentist for it. Okay. I'm going to show you a small video on how to floss.
In addition to brushing twice a day, flossing once a day will help keep your mouth healthy. by cleaning between your teeth where a brush can't reach. It also helps prevent gum disease. Wrap about 18 inches of floss around a middle finger with the rest wound around the opposite middle finger. Hold a small amount of floss, about an inch, tightly between your thumb and forefingers, and gently insert the floss between the teeth. Hug the floss tight to the side of your tooth. Rub the floss gently up and down, pressing against each tooth. And remember, get behind those back teeth. There are other products to help clean between your teeth, especially if you have braces or have a hard time holding floss. Always ask your dentist if you have any questions. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
So like the video explains to you exactly on how to flossing, a lot of common mistakes we hear from the patients is, oh, I floss. But okay, when you ask them how do you floss, going directly between the contacts and pulling the floss out does not work. So you go beneath the contact, you hold the floss, you push it against the tooth, form a little C. You have to hug your tooth all the way, form a C, go 4 to 5 times underneath your contact, and then come out. Going straight up and down actually causes your food to go underneath your gums a lot more. Okay, now the other thing we talk about, okay, what is the correct age to start flossing? Now think about it in this way. What age would be good for a kid to develop a good dexterity, correct? The most common things we tell patients, okay, by the age that they are 7 or 8, their contacts or their teeth all come together. The contacts are closed up, the teeth are nice and snug together. We recommend patients, okay, you know what, start flossing. Start helping your kids on how to floss. There are many methods of flossing, or there are many, I would say, means of flossing. Either you can use something what we call as a regular floss, something that comes like these, or you also get floss picks. Those are a good thing to have, especially when you're starting kids on flossing. People who have braces come and complain, oh, I can't floss. Mm-hmm. You can still floss. There's something what we call as either super floss, okay, that comes with a little more stiff end and a floss attached to it. So it's a lot easier for you to go underneath those wires, go between your contacts, clean them really nice. Girls are they develop a little more faster than boys. Generally, we say, okay, you know what? Girls start to learn to floss a little more sooner than the boys. Now, same thing like I told you, on how to flossing, rub the floss gently up and down, keeping it pressed against the tooth. That is the most important thing. The other thing I always tell patients, do not overfloss. You are harming your gums more than helping out. Okay, don't jerk or snap the floss. Now, when we talk about floss again, there are 2 types of flosses. One, what we call as a waxed floss, okay? One is an unwaxed floss. Waxed flosses are a little more thick, so people who have, not an extremely tight contact, it's a lot easy to glide and clean, and they're more easy to work with. An unwaxed floss is good for people who have extremely tight contacts. They're like, oh, doc, I try to put it in, my floss snaps. Okay, that means that you don't either have enough space or your teeth are too tight together. So in patients like those, I would recommend try using a unwaxed floss. Okay. The one other thing that you can add to your regimen is what we call as a water pick. This is a really good tool to add to your oral hygiene regimen. It's good, especially good for patients who have gaps between their teeth. That either we call those black triangles. So if you notice, all teeth, you're going to have some areas of open ends that you would see between your teeth. This could be in reaction, either your gum receding, it could be in reaction to age, it could be in reaction to a constant irritant that's around there or has been there. Most commonly seen when you have like a large filling between 2 teeth. Gums tend to start shrinking. What you do, how to clean those areas, or you have food impactions between your crowns. Best thing, use a water pick. It'll help flush those areas. We also call it like a water floss. Now, water floss or water pick is not a substitute for flossing. You have to floss. This is an addition to it. Helps flush those areas a lot better. Especially when you have a wisdom tooth extraction, I recommend patients, okay, don't try to put the pressure or directly into the socket. You can clean around it, but never use a water pick directly into an extraction site. Okay. The next topic that we're going to talk about is oral rinses. That's And again, another good adjunct to your oral hygiene regimen. Okay. Now, when we talk about mouthwashes, again, there are two types. One that is more for cosmetic reasons. The other ones that's more therapeutic. Cosmetic are the ones that you usually get over the counter. They don't need a prescription, and also depending on the formulation, they can be either over the counter or a prescription based. Therapeutic mouthwashes that we usually prescribe patients is often in patients who either have a severe case of gingivitis, bad breath. It could be because of tooth decay. It's because of extreme inflammation. In cases of perio, we tell patients, okay, use these mouthwashes, has certain instructions. Always, always, always follow those instructions. If there are any changes, your doctor is going to tell you to use a mouthwash in a certain way. Generally, these antibacterial mouthwashes that we recommend patients that the prescription base should never be used for more than 2 weeks at a stretch. It can alter your taste. It can alter, it can change the color of your teeth, not staining. So be very careful. You follow the instructions of your dentist as on how to use those. Depending on the cases or depending on the severity of a certain case, we change it. Okay? Children under the age of 6 should not use mouthwash, regardless, unless and until the dentist actually tells them, okay, yes, this kid will actually benefit from a mouthwash. Do not give the kid, unless until you're monitoring it. Okay. The reason being is a lot of these kids, what happens is if they are not monitored, if they're not supervised, kids can swallow these. Now, if you actually look at the back of these mouthwashes, it will tell you the content of it, the strength of it, the chances of, the kid ending up with vomitings, with blue stools, having basically what we call as poisoning. So be very careful. So always I recommend for kids, unless there is a specific reason. It could be whether the patient has a genetic condition, where there's excess inflammation in the mouth. So we try to use adjunct procedures to help bring it down. Okay. So only and only in those cases that we recommend patients below the age of 6 can actually use mouthwash. If not, I would suggest don't use it. Unless only they know, okay, yes, you got to spit it out. You got to spit it out. Next thing I always hear, okay, when we go to kids, okay, toothpaste. What do we use? How much do we use? Fluoride toothpastes the kids need it. As soon as the first teeth starts to come in, you have to use a fluoride toothpaste. Now, why? When we talk about fluoride toothpaste, a lot of I've had parents who are concerned, okay, I don't want to give my kid fluoride. It has poison in it. Well, if you swallow it in a huge amount, yes. But that's the reason when you do it, there are certain ways or a certain amount that you're supposed to dispense when, depending on the kid's age. Fluoride is basically something that would prevent or that would actually make it a little more stronger or more resistant to decay. Our tooth or our structure, what we call as your enamel, is comprised of certain crystals, what we call as hydroxyapatite crystals. Now, when we use fluoride, these crystals, the fluoride from the water source or the toothpaste that you use, basically what it is, it binds with those crystals, forms what we call as fluorapatite crystals. These fluorapatite crystals are a little more resistant to the acid produced by the bacteria that causes the cavity. So that's one of the main reasons why we actually recommend patients, okay, use a fluoride toothpaste, use a fluoridated water. That means tap water. A lot of the bottled waters that we get, none of the bottled waters actually even have fluoride in it. So unless you're living in an area where there's excess fluoride that you might use in cooking or something like that, I usually recommend patients, okay, use the tap water. There's benefits for it. When we talk about the amount dispensed, for 0 to 3 years of age, the moment their teeth start coming in, give them a smear. So what you do, you take their toothbrushes, you do get little toothbrushes. You put a little smear on them and then use it for little kids below 3 years of age. Above, once a kid starts to turn 3 plus, maybe 4, depending on you can know that, okay, yes, my kid can actually understand a little bit better. You give them a pea size, nothing more than that. Okay. Now, one other question. When do we take our kid for the first dental visit? There are two things. First, whenever the kid gets their first tooth, it's time for a dental visit. Or the first birthday, whichever one comes first. Not every kid's going to grow the same. Everybody's a little different. Some kids grow a little faster, some kids are a little slower in growth. So we always tell patients either once their first tooth comes in or once they are a year old, whichever one comes first. One of the other more important topics that I would actually want to discuss is the baby bowel decay. Now, what is a baby bowel decay? So a lot of times, I've had patients come in with their 1-year-old, 2-year-old who are still taking bottle to bed. They come in, all the front teeth are decayed. Okay, so I'm going to show you a sample for that. That gives you an idea of exactly what we're talking about. Okay, so these actually show the progression of a baby bowel decay. Initially, you might notice, everything looks okay, perfectly spaced. You might see a little bit of staining starting between these two, basically the front 4 anteriors. Progresses. This is what we call as a mild case. In mild case, you would see half of the tooth, or a little less than half of the tooth start to form a big cavity. Again, goes unnoticed, or the parents don't pay much attention to it. Progresses further. Okay. This is a moderate case, okay? Severe cases where I've actually seen kids come in, 1-year-old, multiple decayed teeth. Patient comes in with abscess, kids crying. We as adults are generally scared to sit in a dentist chair. You cannot expect a 1-year-old or a 2-year-old with damaged decay, damaged infection to sit in the chair and not cry. So that's the reason I would tell patients, okay, make sure you take the precautions before it reaches that. What we mean by that is, okay, never, ever, ever give bottle to bed. If your kid is already in the habit of taking a bottle to bed, you have to change it or add water to it. Or start with actually the moment the kid falls asleep, take the bottle off. Wipe their mouth. Second, if the kid is not used to taking the bottle to bed but likes to have something with him, you can give them a pacifier. But never sugarcoat it. Never put it any kind of sweeteners, any kind of milk, or anything for that sort. Simple water, give it to the kid. Best thing if the kid still needs a bottle, does not want anything in it, but just still needs a bottle. A lot of kids use that as a safety. They feel more secure with it. What you could do in those cases is you can add water to the bottle. I can understand kids can be very fussy. So yes, use a pacifier, okay, or use a bottle with water in it. The other thing I tell patients, okay, make sure you use a 2x2 gauze, wipe, get a nice clean gauze, soak it, wipe it around your kid's mouth, make sure, there's no residual remaining. So the kids, when they go to sleep, there's not all that bacteria sitting continuously on the teeth. Now imagine you're giving your kid a bottle to bed that acts basically like a substrate. All that bacteria that's sitting in the mouth has food now. They go on they go on a bench eat. Produces too much acid. That's the thing that actually starts to cause decay in the kid's mouth. Never, please, this is one request I always tell patients, do not give your kid a bottle with milk to bed. At that point, you might feel like, oh, my baby's crying, I have to give it, but a fussy baby is hard to handle, but a baby with that kind of pain is going to be harder to handle, okay? Wean your baby off a bottle before they turn 12 months. That's very important. The sooner you wean them off, the less are the chances of these things happening. Does that mean it's not going to happen? No. I've seen patients, okay, kids might come in, okay, different masochistic habits. You just have to monitor them. Make them, the moment you see them, okay, are they starting something? Take them. Don't wait for any condition or anything to go wild in the mouth before you start taking care of it. You really don't want something to go to a point where, okay, at this point, I can't do it, just take it out. We just don't want that. Next, coming to a little bit about diet. When we talk about most common things that we notice in a lot of adolescents and a lot of young kids these days is pop. Okay. too much sugar in it. I've had kids, 14-year-olds, love pop, love Gatorade, but do not like to brush. They don't exactly go hand in hand. Okay, you have to make sure you brush. Might look a little tedious, but you have to. Okay, now let's show you a sample of how much sugar contains. A lot of us are like, oh yeah, we look at it, oh, it's not that bad. We can still do it. It's an energy drink. It gives you energy. Gatorade. What is it basically? If you look at its work down in the back, it'll tell you exactly how much sugar is in it. Okay, 1 can of any energy drink, Monster, will have this much sugar in it. Okay, this isn't talking about 1 can. It's a 16-ounce can. You're going to have 54 grams of sugar. That's a lot of sugar in one go, right? Or the other more common things that we see are patients, kids come in. I've had patients come in, they're sitting on either Dr. Pepper, Coke bottles, 20 fluid ounce bottles. Each one is going to have this much sugar in it. It's a 20-ounce bottle. So imagine that with one sitting, you're taking this much sugar. What's going to happen? Okay, so I always recommend patients, please drink lots of water. If you really have that urge to drink Coke, if you really have that urge to drink sweet tea, anything. A lot of people are like, I'm going to give fruit juices to my kids. There are still sugars in it. They're not synthetic sugars, but they're still sugars. They're natural sugars, so it's going to have the same effect. So we usually tell kids, okay, parents were like, my kids want juices, dilute it. As much water as you can. You might give them like 1/4 cup of juice with like the rest of it with water. Do that. It's better to do that than to actually make your kids go through something as bad as this. That is one of the main things I really want to talk about. Last topic, we talk about smoking. I know a lot of people don't like talking about it, but smoking is not just good for, is bad, not just for your teeth, but for the rest of your body, okay? The amount of tar that builds up, first thing you're gonna see is deposition on your teeth, on your gums, on your tongue, changes color. Brushing those are very important. So for smokers, when we talk about toothbrushes or toothpaste, or any patient that comes in with too much either, any kind of staining, too much staining, we recommend patients to use a toothpaste that's got a little more abrasives in it. Most commonly that we recommend them is a crest one, not the Pro Health, the crest, the regular crest. Has more abrasives in it. Helps, remove these buildups on the teeth a little more efficiently. Okay. Brushing, again, never ever go in horizontal motion. I've seen a lot of patients come in with these little dips or little depressions along your teeth. These over time can make your teeth extremely sensitive. You're going to end up amputating your tooth right off it. So soft bristle brush. Right now we're talking about smokers. Soft bristle brush, a toothpaste with a little more abrasives in it. Okay. This is not to scare, but this is just to let you know that this is something what we call as a tar jar. So UIC, I would usually show this to a lot of my patients. This is an approximate amount of tar that passes through a smoker's lungs each year from smoking, even if you smoke, like say 10 cigarettes a day, right? This is what you're gonna end up with. That's amount of tar within a year of buildup. So I am pretty sure not everyone likes to walk around with this. So I know it's hard cutting down smoking, but there are various methods, and we always encourage patients. Look for alternatives. Look for something that's going to help you quit. One good reasons I've seen patients like, okay, when you have an extraction, I tell patients, do not smoke that. That gives them a good reason to quit smoking. Is okay. If you smoke after you have an extraction, you're going to end up with a lot of pain that you really don't want to even look at, or you really don't want to experience it. Okay. That was mainly for smokers. Now, the other, or one of the last things that I really want to discuss is the effects of vaping. A lot of, I hear a lot of youngsters, I vape. Extraction, I vape. You get any surgical procedure, I just vaped, I just took a puff. Anything, be it cigarettes, vapes, they increase the temperature in your mouth. When that happens, there's a lot of blood flow in that area in your mouth that causes the inflammation to go up. That makes your gingivitis issue, your periodontal issue worse. So these two things never go hand in hand. Anything that can raise the temperature in your mouth is generally, especially after an extraction, not a good idea. Especially when you have a procedure like BB extractions, BB deep cleanings. We generally recommend patients, okay, try not to drink anything too hard, try not to eat anything too hard, just so that, you're going to give that time for your gums to heal before you actually put them through that again. These are one of the few things that I really wanted to discuss today. Again, I would really, really, really recommend take your kids for their 6-month checkups. It's easier for us to catch something when it's in their initial stages and treat it. When you treat any issue in its initial stages, it's a lot easier, not just pain-wise, time-wise, money-wise, mental health-wise. A lot of patients come and, okay, you know what? I was just scared. I didn't go to the dentist. Now it builds up. It builds up to a point where it becomes too bad, and now they have to go through a procedure that might be a little more invasive, a little more painful. That makes the whole experience worse for patients. So generally, I would tell patients, okay, make sure, get your 6 months checkups done, get your cleanings done, especially if you're a perio patient or patients who are experiencing bone loss or patients who are experiencing a lot of bleeding. Make sure, get your cleanings done every 4 to 6 months. Pregnant women, they end up, because of the hormonal changes, you're going to see we have patients come in because of hormonal changes, their gums are super inflamed. Now add all that build up to it. What does it do? It makes it worse. Doesn't make it any better. It makes it a lot worse. So already somebody's already in agonizing pain. You're putting them again through something. We don't want that to happen. So what we tell patients, okay, even if you are pregnant, get your cleanings done. You can go for procedures like cleanings just to make sure that, okay, you know what, you're reducing all that bacterial content in your mouth that can actually pass down to the fetus as well. Okay, so generally that is another common thing that I've seen. Okay, pregnant women, they come in medication-wise, medical conditions. There's a lot of things that come into play when we talk about gums and teeth. Your mouth is basically sole source of entry for anything directly into your entire system. I mean, you have nose, but mouth is something that you can actually control. Okay, you're chewing, you're eating, you're putting everything through your mouth. Anything that goes in will eventually come out from somewhere. So you just have to be a little more mindful of where it's coming out from, be it your gums, your pockets, a lot of times any of these, like for example, we talked about smoking or the tar buildup, not good for you. All that sugar, not good for you. It's just going to make the whole situation it not only affects your mouth, your tissues, but it affects your entire system. All that bacteria that sits in the mouth will affect the rest of your system. That's the reason more commonly, if you notice, people say, okay, if you already have a heart condition, make sure you see your dentist. Why? Because a lot of these bacteria that are in the oral cavity, not all bacteria are bad. Again, not all bacteria are bad, but anything in excess is bad, regardless of even if it's good. So that's the reason we tell patients, okay, if a patient already has a heart condition, make sure you see your dentist. You do not want all that bacteria that sits in your mouth. It's the same bacteria that sits in your mouth that can cause an endocarditis. It's a heart condition. So we always tell patients, okay, you know what? If you have a heart condition or if you have diabetes, make sure you see your dentist. Diabetes and, again, bone loss, they go hand in hand often. So we tell patients, you have a diabetes, if you are diabetic, make sure you see your dentist, get your cleanings done. You really don't want to lose all those teeth. So now that we spoke about various things, thank you for giving me this opportunity, IMANA. I hope I was able to share my knowledge with you guys, and I'll be taking a few questions shortly. But main thing, again, I would like to leave you with a simple thing that please make sure you and take whatever you do, you're your kid's first teacher or first model. Anything you do, your kid is going to imitate it, be it your drinking habits, be it your eating habits. So please set a good example for your kids. It is going to reflect them in the future. Make sure that they have pleasant experience with their doctors, be it your doctors, be it their dentist. This is going to reflect it for the rest of their lives. That's going to help them. Okay, you know what? I had a good experience with the dentist. I can actually go back to the dentist. If you put your kid through a more tougher situation with the dentist, that fear instills with them for the rest of their lives. They will not want to go back. So I always tell patients, whatever you do, your kids are going to learn from it. So make sure you set a really good example for your kids. Thank you so much, IMANA. If we have any questions now.
Thank you, Dr. Amjed. That was a great presentation, and for really simplifying, how easy steps that one can undertake just to take care of their mouth and their teeth and the gums, which is such a common area and that needs to be taken care of. So we do have a couple of questions.
Sure.
So someone mentioned, do you recommend any specific toothpaste? Is Aqua Fresh okay? Just because there's so many brands out there. Do you have any recommendation?
So if you actually look, anything that has already been approved by your AD or FDA, that is a good thing. But generally for people, a lot of them, generally we say, okay, you know what, use Crest Pro Health. That is one thing I usually recommend my patients, but I will not specify, okay, use only this. There are a lot of brands out there. Now, one thing also I tell patients, okay, some patients are allergic to certain toothpaste, to certain ingredients. So be mindful of that. Anything, if you already have your gums are, issue going on, be either be inflammation or it could be a genetic condition that causes inflammation of your gums, nothing with cloves in it. Please, this can burn your tissue even more. So nothing, as long as it doesn't have any kind of cloves in it, pretty much all the toothpaste, if you actually just compare all the brands, if you just look at their back, ingredient wise, they're pretty much all the same. It's just a different packaging. I could put a different toothpaste in a different packaging and give it and people won't know it. So it's pretty much the same exact thing.
You're right. Okay, thank you so much. Another question is, it's a common act where people only visit the dentist when they have some sort of toothache. So, to cut that down, how frequent should one visit a dentist or a dental hygienist?
Like I mentioned earlier, even during the webinar, that seeing your dentist every 6 months is a recommended time. Now, if you have something where we do, okay, if depending on the severity of your case or depending on the severity of the issue that you have, that could be either because of your caries index, that means a patient is more prone to cavities, or a patient is more prone to perio issues. We tell patients, okay, perio issues, see a dentist every 4 months. If a patient's very prone to cavities, see a dentist a little more frequently. There's no harm. The only reason why a lot of people go every 6 months is because of the whole insurance issues. But from dental perspective, we tell patients every 6 months, go take your kid with you. Even if it means he's going to sit there in the corner and watch you. Yes, please take them with you.
Okay. And another question we received was, do I need to clean my baby's gums after a feed or just wait to brush their teeth after they have their first set of teeth?
No. So it's anything, once you start feeding, it's an open area. Okay. You have to make sure you're cleaning it. Once you feed your baby, use a gauze, you use a 2x2, just wet it, just wipe it all around. That's good. All this decay, the longer, once a tooth comes in, you have to brush. But before the teeth comes in, you have to use gauze to wipe it down. When you don't clean them, or if the patient or if the kid goes to the bed with these bottles and stuff like that, that will cause a decay. Once you leave that decay for a long time untreated, the permanent teeth that are going to come in, a lot of people are going to be like, oh, what? It's just a baby tooth. It's going to fall off. I'm just going to wait for the permanent ones to come in and let these be as is. No, what this does is when you have an infected tooth or a decayed tooth sitting in your mouth for too long, it starts affecting the permanent tooth that's supposed to come in. That's when you see a lot of people walk around with either some sort of spotting on your teeth, some discolorations on your teeth. That's because either the baby tooth was previously decayed, infected, trauma, multiple reasons. So baby, no tooth, still you have to wipe it down.
Okay, thank you. And another question was flossing causes my gums to bleed. Should I still continue doing it?
Yes, well, that also depends if you're over-flossing. Remember we spoke about, do not over-floss. A lot of patients are like, okay, my gums are bleeding, I'm gonna floss, maybe something stuck. They keep going. Now, that means you're traumatizing your gums too much. If you initially, when you floss, there is a chance you will bleed. That's normal, okay? But that does not mean that either you over-floss it, does not also mean that you don't floss it, okay? You floss once, okay? As long as you've got everything out, your gums are gonna be swollen, so you might feel like with something still there. Floss, use a mouthwash, leave it. Next day, repeat the same thing. You will notice it start to go down. But if you notice that no, it's still either swelling up too much or it starts to hurt your tooth, go to your dentist. They might be able to flush that area pretty well.
Okay, perfect. Thank you so much. So that was the list of questions that we had. If you have any closing comments, but I think you really put it forward really well about how the importance of it, and doing it right.
I hope we all learned something from this today. And I would really, really encourage all the new moms to pay a little more attention to their kids, or, when they brush, and instill these good oral hygiene habits at a younger age, which they will be able to carry, for a really long time for their future. Adults, guys, smoking. I don't want to show that jar again, but let's just focus on these little things that will actually help build your health up as well. A healthy mouth will definitely go a long way.
Jazakallah khairan, Dr. Amjed, and I think we've wrapped up with the questions, and thank you so much for your closing statements. I think we will wrap this up for now. Thank you everyone for joining in, and inshallah, if you have any other questions, do feel free to tag us on any of the social media channels, #IMANA Cares, or any of our social media profiles if you have any more questions relating to this, and the webinar will be up on our YouTube page in a few days. Thank you.
Thank you so much. Have a good day. Assalamu alaikum.
Welcome, Salam.